Avoid these 5 tests after 60 to protect your brain from Alzheimer's. What if I told you that some of the medical tests your doctor might be recommending after age 60 could actually be putting unnecessary stress on your brain and potentially accelerating cognitive decline? After decades of research and working with patients facing memory concerns, I've discovered that certain routine medical procedures commonly ordered for people in their golden years can trigger inflammatory responses, disrupt brain chemistry, and even interfere with your brain's natural protective mechanisms in ways that might increase your Alzheimer's risk. By the end of this video, you'll know exactly which 5 tests to question or avoid after turning 60. Understand the shocking science behind why these procedures can be harmful to aging brains. Learn about safer alternatives that can give you the health information you need without the cognitive risks, and discover the specific questions you should ask your doctor before agreeing to any medical test that could impact your mental sharpness. But here's what really concerns me. Millions of people over 60 are unknowingly subjecting themselves to these potentially brain-damaging procedures every single year, simply because they trust that if their doctor orders it, it must be safe and necessary, when the reality is far more complex than most healthcare providers realize. When I first started noticing patterns in my patients who were experiencing rapid cognitive decline, I began to wonder if there might be common factors that weren't being considered in traditional Alzheimer's research. What I discovered was deeply troubling. Many of these individuals had undergone certain medical procedures in the months or years leading up to their cognitive symptoms, procedures that are routinely ordered for people over 60 as part of what doctors call preventive care. But the question I kept asking myself was this: are we preventing disease, or are we inadvertently contributing to the very cognitive problems we're trying to avoid? Have you ever wondered why some people seem to maintain crystal-clear thinking well into their 80s and 90s, while others begin showing signs of memory problems in their early 60s? While genetics certainly plays a role, the medical decisions we make as we age might be having a much bigger impact than anyone realizes. The first test that raises serious red flags for brain health after age 60 is repeated CT scans, especially when they're ordered routinely or for minor complaints. Now, I'm not talking about emergency situations where a CT scan could be life-saving. Those are entirely different circumstances. I'm referring to the practice of ordering multiple CT scans over time for headaches, minor injuries, or as part of routine screening protocols. Each CT scan exposes your brain to ionizing radiation, and here's what many people don't realize. The aging brain is significantly more sensitive to radiation damage than younger brains. The blood-brain barrier, which protects your brain from harmful substances, becomes more permeable as you age, allowing radiation to penetrate brain tissue more easily and cause more extensive damage. Are you someone who has had multiple CT scans in recent years, perhaps for headaches, dizziness, or minor accidents? If so, you might be accumulating radiation exposure that could be contributing to cellular damage in the very organ you're trying to protect. Research has shown that repeated exposure to medical radiation, even at the levels used in diagnostic imaging, can trigger inflammatory processes in the brain that persist long after the scan is completed. This chronic inflammation is one of the key drivers of Alzheimer's disease and other forms of dementia. The cumulative effect of radiation exposure is particularly concerning because your body doesn't simply reset after each scan. The damage accumulates over time, and older brains have reduced ability to repair radiation-induced cellular damage compared to younger brains. Think of it like repeatedly sunburning the same patch of skin. Eventually, the damage becomes permanent and can lead to serious problems. The same principle applies to your brain tissue when exposed to repeated CT scans. What makes this even more concerning is that many of the conditions CT scans are used to evaluate in people over 60 can be assessed just as effectively with non-radiation imaging techniques like MRI. However, CT scans are often chosen because they're faster, cheaper, and more readily available. But when we're talking about protecting your most precious asset, your cognitive function, shouldn't we be prioritizing safety over convenience? Have you ever asked your doctor whether an MRI might be a safer alternative to a CT scan for your particular situation? The second problematic test for brain health after 60 is excessive blood work that includes heavy metal panels or multiple contrast dye procedures. While blood tests seem harmless, frequent drawing of large quantities of blood can actually stress the aging cardiovascular system and reduce the oxygen-carrying capacity that your brain depends on. More concerning are the contrast agents used in many imaging procedures and specialized blood tests. These chemical compounds are designed to make certain structures more visible on scans, but they can cross the blood-brain barrier and accumulate in brain tissue. The contrast dyes used in medical imaging contain heavy metals like gadolinium, which has been found to remain in brain tissue long after the procedure is completed. In older adults, whose natural detoxification systems are already working less efficiently, these metals can build up over time and contribute to oxidative stress and inflammation in the brain. Have you noticed any changes in your thinking or memory after undergoing procedures that required contrast dye? While the immediate effects might be subtle, the long-term accumulation of these substances could be contributing to cognitive decline in ways that won't become apparent until years later. The frequency of these tests is often driven more by medical protocols and liability concerns than by actual medical necessity. Many doctors order comprehensive blood panels and imaging studies as a way to cover all bases, but they may not be weighing the potential cognitive risks against the actual benefits for each individual patient. This is especially true when patients have multiple doctors who aren't communicating with each other about the cumulative exposure to various testing procedures. Are you seeing multiple specialists who might each be ordering their own set of tests without knowing what other procedures you've had recently? This lack of coordination can lead to unnecessary duplication and overexposure to potentially harmful substances. Keeping a detailed record of all your medical tests, including dates and types of contrast agents used, can help you and your healthcare providers make more informed decisions about future testing. The third category of tests to approach with caution after 60 involves procedures that require sedation or anesthesia, particularly when they're ordered for screening purposes rather than to address specific symptoms. Colonoscopies, endoscopies, and certain cardiac procedures often require sedation, and there's growing evidence that anesthesia drugs can have lasting effects on the aging brain. The phenomenon known as postoperative cognitive dysfunction, or POCD, can occur after any procedure involving anesthesia, and older adults are at significantly higher risk. What's particularly concerning is that some of the cognitive changes following anesthesia may not be immediately obvious. You might feel fine a few days after the procedure, but subtle changes in memory formation, processing speed, or executive function could persist for months or even years. Research has shown that people over 60 who undergo multiple procedures requiring anesthesia have a higher risk of developing dementia later in life compared to those who avoid unnecessary sedated procedures. The drugs used for sedation can disrupt the delicate balance of neurotransmitters in the aging brain, and recovery from these disruptions takes longer as we get older. Additionally, the stress of medical procedures themselves can trigger the release of cortisol and other stress hormones that can damage brain cells, particularly in the hippocampus, which is crucial for memory formation and one of the first areas affected by Alzheimer's disease. Have you undergone screening procedures that required sedation? And did you notice any changes in your thinking or memory afterward? Many people dismiss post-procedure cognitive changes as temporary effects of the anesthesia, but research suggests these changes might be more persistent than previously thought, especially in people who already have subtle, undiagnosed brain changes related to aging. The fourth problematic category involves frequent cardiac stress tests, particularly those that use radioactive tracers or require powerful medications to stress the heart. While heart health is undeniably important for brain function, the methods used to evaluate cardiac function in older adults can sometimes cause more harm than good. Nuclear stress tests expose patients to significant amounts of radiation, often more than multiple CT scans combined. and the radioactive materials used can potentially cross the blood-brain barrier. The medications used to simulate exercise stress in people who can't perform physical stress tests can also have unintended effects on brain function. Drugs like adenosine and dobutamine can affect blood flow patterns throughout the body, including the brain, and in older adults with already compromised vascular systems, these changes could potentially trigger or worsen cognitive symptoms. Moreover, the stress response triggered by these tests, both physical and psychological, can be particularly intense for older adults. The flood of stress hormones released during cardiac stress testing can remain elevated for days or even weeks after the procedure, potentially contributing to the chronic inflammation and oxidative stress that are hallmarks of Alzheimer's disease. Are you someone who experiences significant anxiety before medical procedures? And have you noticed any correlation between stressful medical tests and periods of increased forgetfulness or mental fog? The fifth, and perhaps most controversial, category of tests to reconsider after 60 involves certain types of biopsies, particularly those of the brain or procedures that require navigation through blood vessels that supply the brain. While biopsies are sometimes absolutely necessary for diagnosis, the trend toward more aggressive tissue sampling in older adults for relatively minor concerns can pose risks that outweigh the benefits. Brain biopsies, even small ones, create inflammation and scar tissue that can disrupt normal brain function. The aging brain is less resilient and takes longer to heal from any type of injury, including the controlled injury of a medical procedure. Similarly, procedures that involve threading catheters or instruments through the carotid arteries or other vessels that supply the brain can dislodge small clots or plaques that travel to the brain and cause mini-strokes or microinfarcts. These tiny areas of brain damage might not cause immediately noticeable symptoms, but they accumulate over time and contribute to what researchers call silent strokes, brain injuries that gradually erode cognitive function without causing obvious neurological symptoms. The cumulative effect of multiple small brain injuries from medical procedures could be a significant but under-recognized contributor to age-related cognitive decline. Have you ever been told you've had silent strokes or small areas of damage on brain scans? And do you recall having any vascular procedures in the months or years before these changes were discovered? The connection between certain medical procedures and subsequent brain changes is often overlooked because the effects may not become apparent until long after the procedure is completed. Understanding these risks doesn't mean you should avoid all medical care. Quite the opposite. It means becoming a more informed healthcare consumer who asks thoughtful questions about the necessity, timing, and alternatives for any proposed medical test or procedure. The key is finding the balance between appropriate medical care and avoiding unnecessary procedures that could potentially harm your cognitive function. When your doctor recommends any test or procedure, consider asking these important questions. Is this test absolutely necessary right now, or could we safely wait and monitor symptoms? Are there alternative tests that don't involve radiation, contrast dyes, or sedation that could provide the same information? What are the specific cognitive risks of this procedure for someone my age, and how do they compare to the potential benefits? Have you considered my cumulative exposure to medical radiation and contrast agents when making this recommendation? The concept of medical minimalism, using the least invasive, safest approaches necessary to maintain health, becomes increasingly important as we age and our brains become more vulnerable to the unintended consequences of medical interventions. This doesn't mean avoiding necessary medical care, but rather being more selective and strategic about which tests and procedures are truly worth the potential risks. Are you someone who tends to agree to any test your doctor recommends, or do you ask questions about alternatives and necessity? Developing a more collaborative relationship with your healthcare providers, where you're actively involved in weighing risks and benefits, is one of the most important steps you can take to protect your cognitive health while still receiving appropriate medical care. It's also worth considering the timing of medical procedures and tests. Spacing them out over time, rather than having multiple procedures in a short period, can give your brain and body time to recover between interventions. Additionally, ensuring that you're in the best possible physical and mental condition before undergoing any procedure can help minimize the cognitive risks. The role of inflammation in Alzheimer's disease cannot be overstated, and many medical procedures trigger inflammatory responses that can persist long after the immediate effects of the procedure have resolved. Chronic inflammation in the brain is like a slow-burning fire that gradually damages neurons and the connections between them. Each medical procedure that triggers inflammation adds fuel to this fire, potentially accelerating the very cognitive decline you're trying to prevent through medical monitoring. Have you noticed that you seem to get sick more easily or take longer to recover from illnesses after medical procedures? This could be a sign that your immune system is being overstimulated by repeated medical interventions, leading to the kind of chronic inflammatory state that's harmful to brain health. Supporting your body's natural healing processes between medical procedures becomes crucial for maintaining cognitive function. The financial aspect of excessive medical testing is also worth considering, not just from a cost perspective, but because financial stress itself is a risk factor for cognitive decline. Unnecessary medical procedures can lead to unexpected bills, insurance complications, and the stress of dealing with medical billing issues, all of which can contribute to the chronic stress that's harmful to brain health. The psychological impact of frequent medical testing can also be significant. Each test or procedure carries with it anxiety about results, worry about potential health problems, and the stress of navigating the healthcare system. For people already concerned about cognitive changes, the additional stress of frequent medical monitoring can actually worsen the symptoms they're trying to prevent or detect. Are you someone who worries excessively about medical test results? And have you noticed that this anxiety affects your sleep, concentration, or overall well-being? The psychological burden of over-monitoring your health can sometimes cause more harm than the conditions you're trying to prevent, especially when it comes to maintaining cognitive function. The importance of having a trusted primary care physician who can coordinate your medical care and help you make informed decisions about testing cannot be overstated. A doctor who knows your complete medical history, understands your values and preferences, and is willing to discuss alternatives to standard protocols can be invaluable in protecting your cognitive health while ensuring you receive appropriate medical care. Building a relationship with a healthcare provider who practices what's called precision medicine, tailoring medical care to your individual risk factors, genetics, and life circumstances, is becoming increasingly important as we learn more about how standard medical protocols might not be appropriate for everyone, especially when it comes to protecting brain health in older adults. The concept of number needed to treat versus number needed to harm is crucial when evaluating any medical intervention. For every test or procedure, there's a calculation of how many people need to undergo the intervention for one person to benefit, balanced against how many people might be harmed. As we age and become more vulnerable to the side effects of medical interventions, this calculation shifts, and procedures that might be beneficial for younger people could be harmful for older adults. Have you ever asked your doctor about the specific statistics for any recommended test? How likely it is to find something actionable versus how likely it is to cause problems or lead to unnecessary follow-up procedures? Understanding these numbers can help you make more informed decisions about your medical care. The phenomenon of cascade medicine is particularly relevant for older adults. This occurs when one test leads to another test, which leads to another procedure, and so on, creating a cascade of medical interventions that may not have been necessary if the initial test hadn't been performed. Each step in the cascade carries its own risks, and by the end of the process, the cumulative risk can be substantial. If you've made it this far, you clearly understand that protecting your brain health requires more than just eating well and exercising. It requires being a thoughtful, informed participant in your own healthcare decisions. I want to hear from you in the comments. Which of these 5 tests surprised you the most? And have you ever questioned your doctor about alternatives to recommended procedures? Share your experience with medical decision-making after 60 and let others know if you've noticed any changes in your thinking or memory after medical procedures. If this video has given you new insights into protecting your cognitive health while navigating medical care, please hit that like button and subscribe to stay informed about the latest research on brain health and aging. For those dedicated viewers who stayed until the end, click on the next video appearing on your screen to discover the 5 simple questions that can help you evaluate any medical recommendation and protect your brain while still getting the healthcare you need.